Good evening, everyone. Thank you. My name is Jonathan Kotch, and I'm wearing two hats tonight. Some of you might have seen me behind the table where I'm representing Healthcare for All North Carolina. Healthcare for All North Carolina is the state chapter of Physicians for a National Health Program, and we have been advocating, thank you, we've been advocating for single-payer healthcare for at least the last 16 years that I can remember. And I want to thank the rest of you for joining us finally. Then, I'm also the co-president of the Kahila Synagogue. So actually, the reason I'm up here is to welcome you to the Kahila. And I know there are probably people here who haven't been here before. I want to thank our Social Action Committee members, Susan Segal and Kathy Kaufman, who are here tonight, who brought to the board the proposal that we host this meeting, and that proposal was passed unanimously. We're a progressive and an inclusive congregation, and we're very grateful to you for asking us. And we hope that you have, and we have, an excellent meeting. So thanks again for coming out. I'm going to turn it over to Rebecca.
Thank you, Jonathan. I'm Rebecca Cerese. I'm a healthcare activist, and I'll be your host for what I hope is an educational and an engaging evening. I want to thank Jonathan for his warm welcome to this really beautiful space. Thank the rest of the Kahila group, including Stephanie and Sherry, for helping us get set up, and Susan and Kathy for helping to secure the space for us. Building social movements requires creating diverse coalitions, and we're so happy that so many of our partners are able to join us today. We hope that you had some time to meet them. I saw that you did, which was wonderful. So I want to take a few minutes to thank the organizations for their support. Hillsborough Progressives Take Action, the Progressive Democrats of Orange County, the Community Health Coalition, the Coalition for Healthcare of North Carolina, Chapel Hill Carrboro NAACP, and the statewide NAACP. Want to make a special mention of Reverend Rodney Sadler, Dr. Reverend Rodney Sadler. He's the head of the healthcare outreach for the state NAACP, and he's a real champion for this issue. And in fact, he's planning on doing trainings around this issue around the state, which is really exciting. Together We Will North Carolina, Our Revolution, Creative Spark, Carolina Jews for Justice, Health Advocacy Project of the NC Justice Center, Hillsborough Progressives Take Action, the Healthcare Committee team, Carolina Peace Center, NARAL Pro-Choice NC, Binkley Baptist Church Outreach Committee, Holistic Health Studio, Healthcare for All NC, Neighbors on Call, Kirsten Smith, and the local chapter of the U.S. Pain Foundation. So lots of great partners, so thank you. I wanted to give a special shout out to the organizing committee for this event, our fearless leader, Katrina Wesson, our artist in resident, Erica Hamlet, who created the decals, the buttons by hand, our beautiful graphic, Susan Segal for the press release, for the program, and a million other things. She's wonderful. And the other fantastic women in our group, Beth, Nina, Marianne, Debbie, and also a heartfelt thanks to Nan Fulcher for her hard work and design on our flyer, which is back there. I think it's a really spectacular flyer that gives sort of an overview of improved Medicare for all. And then I also want to thank John Luca, who is filming for us tonight. Thank you, John Luca. So this event could not have happened with all these wonderful people, so I wanted to thank them. So before we get too far, I want to show you a couple actions to be thinking about. So if you haven't signed up at our table in the back, sign up for our weekly action alerts. There is the link up there, or you can do it on our table after or on your way out. We also have evaluations, which you saw on your chairs. We also have an evaluation online. We want to hold more events like this, so we really want to know what worked, what didn't work, what you learned. So please fill out the evaluation. I know it's not something everyone loves to do, but it will be really helpful to us as we plan for future events. Also, if you want to tweet something that you learn here to one of our representatives, feel free to do that. We have Senator Burr, Representative Price, and Senator Tills' Twitter handles. We're using the hashtag Healthcare for All, Y'all. And if you hear something that you think they need to know, feel free to either tag them in Facebook or tweet at them about it. Also, you don't need to be like writing down furiously, because we're going to put this PowerPoint presentation up on the HPTA healthcare website. So, and there's the URL for that, so you'll be able to visit that after. So I got involved in this movement in 2009 during the ACA hearings. My mom had been diagnosed with breast cancer, and she had no insurance. And she went through getting her breast removed, chemo, radiation, and all the while she was getting collection notices from the hospital. They were wonderful in treating her, but she had to deal with this added stress of having to worry about how she was going to pay for it, her credit being messed up, all that sort of stuff. And I knew that I had to work to change this system, because I didn't want any other family to have to go through something like this again. So this is one of my favorite Dr. King quotes, one that not as many people know. But of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. He said that in 1966. And I agree with that. And I think most of you are here because you instinctively understand that we have a dysfunctional, inefficient healthcare system that is failing millions of our people, and you know we can and need to do better. Sadly, only in America can you be a victim of mass shooting like the one in Las Vegas, and then be re-victimized financially because the average medical bill for treating a gunshot wound is about $100,000. Even with the ACA, we still have folks filing for bankruptcy due to medical emergencies. And many of us are forced to ask strangers for money through GoFundMe campaigns if we have, or our loved ones get sick, to afford the treatment. Our Declaration of Independence, one of our founding documents, says we should all be guaranteed life, liberty, and the pursuit of happiness. And without our health, these other things just don't exist. This is not a partisan issue. This is a human issue. At this moment, we're in the middle of a healthcare crisis. The rising costs of healthcare are unsustainable. This problem is not going to go away, and we're going to need to work together to create a cost-effective, high-quality healthcare system that our country can be proud of. That is why we're here today, to have an adult conversation about real solutions that are out there. We have our work cut out for us. Insurance companies and big pharma have spent billions of dollars lobbying Congress, and we have to arm ourselves with facts and demand our politicians enact policies that actually help us. A little about the name of the event. We decided on healthcare for all y'all. We're already paying for it because first, we believe that our country can have a healthcare system that covers all our people. Imagine that. And like every other industrialized country on earth. Second, we are already paying for it. We have a bloated and inefficient system with insurance companies with a profit motive standing between us and our doctors. We pay double what most countries pay per capita for health insurance, and in many key areas, our outcomes are worse. And tragically, we have about 30 million uninsured and about the same number underinsured, and they can't access the treatment they need when they need it the most. We can and must do better. An essential tool in the fight for social justice is information. That is why we have put on this forum. We are agents of social change, and we can transform our dysfunctional healthcare system into one that works for all of us. To help us get the information we need, we have some amazing, wonderful speakers lined up. So I'm going to introduce the first one. The first up is Dr. Aparna Jonnal. She's an emergency physician and primary care provider at a free clinic for the uninsured, and she is going to let us know about how our broken healthcare system affects real people on a daily basis. Dr. Jonnal.
Thank you so much. Can people hear me? Okay. Thank you, Rebecca, and thank you, Katrina, for inviting me to speak. I've been really excited about it until I saw the other speakers and realized how qualified they are. I'm not really an expert in this, but I'm hoping I can give you a glimpse into what it's like to be a medical provider in a country that does not have adequate health care for its people. Medical providers get into this line of work to help, presumably to help people, maybe to be the hero that cures cancer, maybe to be on the front lines of disasters, but at the very least, we want to diagnose and treat medical problems. We want people to feel better. But somehow when we start working, these basic goals elude us. I read that in 2013, 40% of doctors reported being burned out, and in 2017, over 50%. This definitely reflects what I see at work. It seems like most of my colleagues are looking for a way out, looking for the next step, something else to do. I know I think about it too. This frustration we feel, this sense of impotence, I really attribute this to our healthcare system. Let me give you an example. When I worked in inner city Baltimore, I had a patient, Mr. M. I got to know him and like him quite well. I had coincidentally delivered one of his daughters when I was a resident, and then I took care of his wife and kids in the emergency room because they didn't have primary care, they didn't have insurance. And he was kind of the strong silent type. He worked a lot of jobs. They all slept on the floor at a relative's house. He probably had a few too many drinks sometimes to blow off steam, but he was a very solid husband and father, given their crushing poverty and stress. Well, one day he came in complaining of indigestion. It was the first time I had seen him. He hadn't seen a doctor in years, and his blood pressure was quite high, 220 over 130. I mean, really high. His EKG didn't look normal. I said, Mr. M, I need to put you in the hospital tonight. I think that we should get your blood pressure down and run some tests on your heart. And he said, oh no, thank you. I can't pay for that. I hear that a lot. I don't know exactly what to say about that. There's no answer. And so I did my best. I referred him to the social worker, and we tried to cobble together some kind of treatment plan on an outpatient basis. I started him on some medication and just hoped for the best. Well, over the years, his blood pressure stayed high, his kidneys failed, and he wound up on dialysis. Now, dialysis is hard. So I watched his quality of life plummet needlessly. I felt helpless, I felt impotent. This feeling of impotence, this knowledge that our patients are going to suffer, not because there is no treatment, there is treatment, and it's actually quite affordable, but just because it's not affordable enough for them. They somehow don't deserve it. That is what's causing physician burnout, at least a large part of physician burnout. Not only is this system cruel, but it's so expensive. Managing Mr. M's high blood pressure would have been a few $100s a year. Dr. Kotch can back me up on this. I mean, it's easy. Dialysis is $88,000 a year, and Medicare pays for most of that. So we're paying for that. So we should have just paid for the $20 a month blood pressure treatment. But, dialysis is an example of how our system is failing. It's profitable. That's why it's happening. The typical dialysis center, I think, makes like $4 million a year. So it creates this perverse incentive to get more patients on dialysis by some elusive administrative, profiteer somewhere. That's wrong. These are real people. Dialysis is not an easy way to live. These are real people, and they deserve better. Along came the Affordable Care Act. And I thought, okay, this is going to be good. This will be better, less tragic for me. I won't be crying on the way home as much. Well, it's a little bit better. More people are insured. But I still think most of us are underinsured. I bet most of the people in this room are underinsured. And what I mean by that is, navigating this labyrinth of networks and co-payments and limitations and deductibles that still make your healthcare stressful and expensive. I didn't have health insurance for a long time. I wound up referred to a collection agency for something, and then I couldn't get my rental application for my apartment. I would have become homeless. I can see how this leads to homelessness. It's just I was young, my parents stepped in to help me out. I have a patient, actually last year I had a patient, so speaking of underinsurance, this woman, she's 24 and she has scoliosis. It's reached a point where she really needs a corrective surgery in order to continue to work. She has insurance, so I referred her to a spine surgeon. and she coughed up the $75 copay. Well, $75, is that a copay? I mean, that just sounds like a pay. But anyway, she paid the $75 only to find out that the surgery would be so expensive that her part would be $2,000 to $3,000. There's no way she can do that. She works behind the meat counter at a grocery store. So she is not going to get the surgery. Scoliosis is usually a fixed deficit. This won't improve on its own. She will probably wind up on disability, which again, we will pay for, you know? And I don't mind, of course, I'm not trying to say we shouldn't take care of our people, but we can just do it so much more smartly. So we're burning out. Physicians, mid-level providers, we're really burning out. This profit-based system is just leaving too many of our patients behind. And not only does this system hurt them, but it hurts us directly. You know, we are increasingly managed by these large corporations whose administrators are pushing us to make them more money. I work for people who make way more money than me. And it's like, work faster, see more patients, bill higher, don't stop to go to the bathroom, don't stop to eat, don't stop to cry over your patient who just died, don't stop to cry over the patient who you know is going to die because they couldn't afford the care that they needed. Don't stop, just keep going, just keep making more money. I don't mean to try to evoke your sympathy. I'm not trying to make this a pity party for doctors. But our suffering, our hurrying, our burnout is getting passed on to you, right? You have all been in a doctor's office where you were just rushed through. Rush, doctors typing or looking at something, not listening, not hearing with their heart, not caring really, making some mistakes. So that's why this is a problem. You know, our suffering is just being passed out to you. These doctors, I trained with them. And trust me, they didn't want to be this way. We don't want to be that way. But this is what the profit motive does. This is what the profit motive has done to medicine. It's completely tainted our practice. And there's a way out for it, which is Medicare for all. I've spent a lot of time being sad for my patients, like really sad, like needing to, you know, talk to people level sad. Doctors have higher rates of mental illness, substance abuse, divorce, and suicide than the general population. But my sadness has turned into anger. Actually, I'm enraged. I'm enraged by a system that is designed to only keep rich people healthy at this point, and designed to keep private entities making criminal amounts of money. And now I'm just angry. People are suffering and dying because of this. But even when we're healthy, we're anxious about how to get insurance, how to keep insurance, will we lose our insurance, and what will happen when we're sick. And that anxiety, it's really constricting. This is not about our individual health. This is about so much more. Because we are overwhelmed with fears right now, you know, jobs, housing, healthcare, it all adds up. It is harder to trust each other. It's harder to be generous with each other. Subgroups of Americans are fighting, right? You are all inundated by news every day about the fights, the protests, this group, that group. You know, people are really at odds right now. Tensions are really high. Things are feeling very tenuous in this country, very ominous, like we're on the brink of something dark, a sort of coming apart of our society almost. It's overwhelming to know where to start, but I think healthcare is where to start. I really think healthcare is where to start. All these infighting groups, give them healthcare. The alt-right, the minorities, give them healthcare. The oligarchs, the poor, give them healthcare. The Republicans, the Democrats, give them healthcare. The urban, the rural, give them healthcare. I think if each American knew that their health care was covered, that we were all in this pool together, we would be able to breathe. We would be able to welcome others into our lives and into our society. We wouldn't be so afraid. I don't think it's an overstatement to say that universal health care would start to weave back our unraveling society. This is my last point. This is about power too. This is really important. When most of us are uninsured or underinsured, we are so mired in our own struggles that we cannot do the important political work that is ahead. We need to be identifying and correcting the economic and social inequities that we see around us. It is not sustainable or fair to live in a country where only the few are doing well. It's not stable. Ensuring free, quality health care for all would shift this balance of power considerably toward justice and stability for our society. I don't think that's an overstatement. We are going to hear how fiscally prudent this is. Even if it weren't fiscally prudent, this is a moral imperative, and that's why I support Medicare for all. Thank you.